Good morning. Thank you for listening to Community Access. I'm Allison Demers. My guests alongside me today are Dr. Jean Weigert. She is a breast imaging section chief at Jefferson Radiology. And also from Jefferson Radiology, Dr. Samir Hanfi. He is an abdominal imaging radiologist. Good morning.
Good morning.
Good morning.
So you have an amazing event that is coming up on August 28th. It's called Strike Out Cancer Night. Tell me all about it.
Yes, of course. So Strikeout Cancer Night is our way of actually bringing the community together with Hartford Yard Goats to raise awareness about early detection of cancer, celebrate those who have actually fought cancer, and then support cancer research.
So it's taking place at 7 o'clock at the Hartford Yard Goats at Dunkin Donuts Stadium.
That's correct.
Tell me, why is it so important to have an event like this?
Well, so the idea is to support early detection and raise awareness, and then also celebrate those who have actually fought cancer. We do this annually, and the idea is again to get down together with Hartford Yard Goats, have fun, and at the same time raise awareness. We have a table with the foam baseballs and wristbands, a fun photo backdrop.
Fantastic. Why is early detection so important?
Early detection is absolutely the key to better treatment and to saving lives. As a breast imager, we have known over the last 30 years that our rates of mortality have improved significantly with breast cancer as well as other cancers by the fact that we have screening modalities. The most important, of course, is getting your screening mammogram. Other modalities as needed, including a screening breast ultrasound or breast MRI. We also have incredible tools to assist with knowing the risk of getting a breast cancer, and those patients who are at higher risk would therefore also be able to get more of this early detection and hopefully decrease the mortality of breast cancer.
Do we have the highest incidence in the nation as third with breast cancer?
It is third in breast cancer in the state of Connecticut. I have always wondered about that, but it is something that we deal with every day. And again, it makes you want to really be aware of the fact that we have the ability to detect early and therefore to treat better.
While we're at it, can we talk about those risk factors for people who don't know?
Sure. The most important risk factor is being a woman with breasts. You do not need family history, but if you do, that certainly increases your risk. The concept of genetics in the cancer diagnosis is very important, and we have shown over the years that there are many, many genetic factors in the diagnosis and the discovery of breast cancer in patients. Other risk factors include having dense breasts, which increases your risk over 4 times. And again, that is why we have added other modalities into the treatment and diagnosis, including breast ultrasound and breast MRI.
Great. I was going to ask you about that actually. And breast cancer does affect men as well. Is it like a 20% chance for men?
It's about a 1% chance, unless they have the genetic component. And we do find men who are BRCA1 and BRCA2. Those are the 2 most common genetic abnormalities that we find. And those patients are at greater risk of developing breast cancer. And there are now screening guidelines for men as well.
What does cancer awareness mean to you as a radiologist?
It means a lot to us as a radiologist because we play a really pivot role in terms of early detection. And once we detect it, we work with our other colleagues, clinicians in multidisciplinary tumor boards where we help them detect early, monitor response to treatment, and help them guide and manage our patients.
How do you help your patients who are facing cancer?
The first point would be to early detection. If you have family history, we have like Jean mentioned, we have mammograms, screening mammograms. For other cancers, we have your lung cancer screening tools. If you have family history of pancreatic cancer or multiple other cancers, if you have MR modality to screen you annually to make sure you don't have any cancer there. And then basically after that, if you do detect cancer, then we play a role in terms of like doing follow-up imaging to make sure whatever management we're doing with our patients, it's responding well in the right direction, help our clinicians, and once we're disease-free, we want to do annual screening to make sure it's not coming back.
And it's wonderful that they have you instead of Dr. Google. So many people don't get accurate information. And knowledge is everything, because when you're facing something, especially something like this, it may be nothing, but you get yourself all worked up. And then once you have the accurate information, you feel better.
I agree completely with that. One of my jobs as a breast imager, I talk to about 90% of the patients that I see every day. And one of the best things I find I can do is to go in and talk to a patient and say, there is nothing wrong. The symptom that you are having is benign, or the finding that we saw on your screening mammogram that we asked you to come back for some additional imaging has turned out to not be anything worrisome. When I can do that for a patient, I feel I've really done my job just as much as if I do have to detect a cancer.
Right. As a woman, I've had those scares, those little scares here and there, and I've had to wait the weekend or whatever, and everything turned out great, thank God. But I can't imagine being a doctor having to deal with that all the time. How do you stay positive and working in an environment like that?
That's a great question, because I've been doing this for over 30 years, and it is something that I'm very passionate about, obviously. And I do have to tell patients they have breast cancer. I have to tell patients we need to do a biopsy or additional imaging. And I always try and tell patients that we don't know anything until the pathology results are back. And then, depending on what that pathology is, we have tools to treat it. I think for me doing this, I feel very blessed that I am part of this team and that I've been able to use my skills over this many years to help patients. And that for me is really why I continue to work and continue to do what I do.
Dr. Hanfi, has it been gratifying for you as well to work in this capacity?
Definitely, for sure. And then sometimes, like, I remember, like, on Friday evenings, I'll be reading a CAT scan for, like, making sure the cancer not coming back on the patient. You would look at the imaging and there would be cancer, and then you would feel disheartened that, oh my God, I have to break this bad news to this patient, and the clinician will have to go in and tell this information. But at other instances, when there is disease response on imaging, and finally on imaging we can see that patient is disease-free, that's also very satisfying to know that we were there to help out the patient, and now the patient is finally disease-free, and now we can just do an annual surveillance to make sure it's not coming back. So it's definitely gratifying for sure.
And even though, as a patient, I may get bad news, what's so comforting is that you guys know exactly what I need, how to take care of this.
Yes, and then and it's not just one person. Like I said, it's always a multidisciplinary tumor board, like a conference where you would have the oncologist, you would have the radiation oncologist, the surgeon, the radiologist, the pathologist. We will discuss every single case, and we will have the expertise in the same room discussing and what's best for the patient, and come up with a plan and then act on it.
So for people who don't know about Jefferson Radiology, where are you located? What are some of the other services and programs that you offer?
So Jefferson Radiology has many offices around the region. In Glastonbury, in Avon, in West Hartford, in Farmington, and in Hartford. And then we are the radiologists for Hartford Hospital. And we provide many services, not just mammography and body imaging, but neuroradiology, body, musculoskeletal imaging, urologic imaging, and invasive tools like there are lots of tools we now have that allow us to do procedures that used to require a surgeon. And now we can do a minimally invasive procedure to take care of it, correct whatever is the problem, do a biopsy, and move people along in a much more comfortable and less scary way.
We're talking about the Strikeout Cancer Night game that's happening with the Hartford Yard Goats at Dunkin Stadium on August 28th at 7 o'clock. Why is this event so important to Jefferson Radiology?
Well, we care about showing up for the community, not just in the exam room, and in basically in a meaningful way to support these families. So we think about this as we're in this all together, and we want to make a difference to fight against cancer. So again, coming back to the point where it's important for us because we want to support our patients and community for early detection. And if we do end up detecting any cancer, we work with them to make sure they're disease-free.
Wonderful. It's going to be a fun night of baseball while learning about the power of early detection. They're going to honor cancer heroes, which is so touching. It's going to be extremely meaningful. And they're going to be giving away season passes to Six Flags. Again, the event is August 28th, a Thursday night at 7 o'clock. What do you hope people take away from that evening? What do you hope for them?
Well, obviously, we want them to have fun. We want them to have a good time at the baseball game and to show, that we are part of the community and that we in Hartford, we're not a big town, we're a medium-sized town, and that the community can get together to honor our many cancer survivors and those people going through the tunnel of cancer, I call it. You get a diagnosis and then you have to walk through the treatment, the procedures, and then come out the other end. And they do. And that's so important.
I'm speaking with Dr. Jean Weigert. She's a breast imaging section chief at Jefferson Radiology. And Dr. Samir Hanfi, he is an abdominal imaging radiologist. That is quite the mouthful. Your parents must kiss your picture when they say that. Look at my son. He's an abdominal imaging radiologist. Am I right?
Well, they're definitely proud. Being the first doctor in the family, they're definitely really proud of me. And I try to do my best to keep my family proud, not just my parents, but also my wife and my two small kids.
Beautiful. Again, the event is Thursday, August 28th at 7 o'clock. Go to jeffersonradiology.com to get more information. I want to thank you both for being here and for serving the community.
Thank you for having us.